Welcome to our quarterly virtual speaker series, Spring Brainstorm. This series is sponsored by Kessler Foundation as part of our TBI Model System Grant, which is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. Our speaker today is Mandy Dickey, a board-certified nurse practitioner with more than 20 years of experience in healthcare. She currently works at the Minneapolis Clinic of Neurology in Coon Rapids, Minnesota, where she is establishing a specialized concussion program. Throughout her career, Mandy has been recognized for her excellence in leadership. She is a 4-time recipient of the Top Nurse Practitioner Award and has earned the Faculty Excellent Award in her previous role as a nursing professor. Her expertise has been sought after for review committees overseeing several nursing textbooks. She was honored with the Woman of Armor Personal Growth Award in 2023, listed in the Who's Who in America in 2024, and received the Eleanor D. Hands Achievement Award from the Minnesota Brain Injury Alliance in 2025. In 2022, Mandy launched her own podcast, Brain Wellness, the podcast, which now focuses primarily on brain injury topics. She has also been interviewed on numerous other podcasts and has shared her expertise at local, regional, and statewide conferences. Mandy is an active participant in a global traumatic brain injury coalition. In 2023, Mandy experienced a car accident and sustained a traumatic brain injury. This event profoundly influenced her professional practice and podcast, shifting their emphasis toward concussion and TBI care. She integrates both her personal and professional experiences to deliver exceptional, individualized care to people affected by brain injury. Today, Mandy will be presenting on the topic, Thinking Outside the Box for TBI Care. We are pleased to welcome her and thank her for joining us.
Thank you so much for having me, you guys. We're going to be talking about thinking outside the box for the care. So our objectives for today, I'm going to briefly review my interest in this topic. It was kind of highlighted a little bit in my bio there. Review some of the traditional treatments for traumatic brain injury, and then discuss some of those outside the box treatments that not only were beneficial for me, but I have found beneficial for multiple patients over the last year plus being back to work as well. So a little bit about me. And again, my interest in this is I've been in neurosciences since 2000 to some aspect. I was a nursing assistant and then a nurse, then nurse practitioner. And in 2022, as we mentioned, when I started the podcast, because I love teaching and I love educating others, and decided I needed to do something more than what I could do inside the walls of my own facility. And it was intended to be anything related to brain health and wellness, and then shifted after my own accident. But in April of 2023, so we are almost coming up on that 3-year anniversary here, it was a major life change. I thought that I had been doing everything that I could for traumatic brain injury care. I worked in the hospital as a neurohospitalist, saw patients mostly in stroke, but a little bit of everything, as well as the TBI patients that would come in. And I did everything that I was taught in school. And I thought it was a really great job until I was sitting in the patient's side of the experience. From that car accident, I had difficulties with vision, with understanding what I heard and what I read. I had difficulties with my speech. I couldn't get out full sentences without losing my train of thought in the middle of a sentence. I couldn't remember medical terminology. I would hear a term, but couldn't remember what it meant. My balance was off. I had a lot of dizziness, a lot of headaches, a lot of sensitivities to sound, light, senses, smells, everything. So very much life impacting, because it kept me from being able to get back to work. It was almost 2 years before I was actually able to get back to work and had that medical knowledge back again, and could relearn things and could actually read and understand what I was reading. But in the process, I initially did all of those traditional treatments. So we did occupational therapy, physical therapy, saw neurooptometry, which that may or may not be traditional for everybody, but we'll talk about what that looks like as well. And initially, we didn't think I needed to do speech pathology, speech therapy, because we thought that all of my cognitive issues were related to my headaches. So for a really long time, we just kept thinking once the headaches got better, that my cognition would get better as well. So I'm going to say a big oops on that one because that actually wasn't the case. When the headaches finally started retreating a little bit, my cognitive issues were very much apparent. And that's when we realized that we needed to do something about it. But this took about 6 months. So for those first 6 months, I did all of those traditional treatments and wasn't really seeing any changes. So to kind of briefly talk about again what those traditional treatments look like. Occupational therapy in the outpatient world, we work on vision primarily. That's most of the reason why I would refer a patient to occupational therapy after a traumatic brain injury in the outpatient world. In the hospital, it looks little different. They do a lot of the cognitive testing in the hospital. They also do some cognitive treatments outside the hospital as well. And those activities of daily living, the dressing, planning your day, coordinating your day, that's the kind of things that occupational therapy is going to work on. Physical therapy in the outpatient world, again, they're going to work on balance, on proprioception, just identifying where we are in space. And they work on a lot of the neck pain and headache issues that we see after TBI. Again, a little bit different than focus that we have for somebody that's in the hospital when we sometimes might be relearning how to walk. But that outpatient things, that's the kind of things we're looking at. And again, speech language pathology, also known as speech therapy, that's where we get the big meat of all of the cognitive therapies. So I always say that OT does a great job with some of those cognitive things, but I need to do something more advanced, that's when I get patients to speech. And that's anything related to speech. So sometimes my patients will hear the word speech therapy and they think, well, I don't have troubles talking. And it might not be the talking part of thing. It might be understanding what you hear or understanding what you're saying the right words, understanding what you're reading, that those executive functions, decision making, things like that, and memory. That's all under the speech language pathology. And the neurooptometry, this is one where it gets a little tricky. Some people think of it as traditional, some people don't. Oftentimes, if patients are saying that they're having some visual difficulties, they might get sent to a regular optometrist, which your regular optometrist, regular ophthalmologist do a great job looking at your prescriptive needs. Do you need any kind of prescription correction? Do you need reading glasses, for example? They're not typically going to look for the things that cause double vision, which is a common finding after somebody has a brain injury. That's where neurooptometry comes in handy. Neuroophthalmology, again, they're looking at more of the surgical aspect of things or complications related to multiple sclerosis, other things like that. They're really, again, not looking for those traumatic changes. Neurooptometry looks for things that they can do treatments for. And this is where we do therapy, potentially glasses correction for a multitude of something called binocular vision disorders. There's a lot of them. Convergence insufficiency or excess would be there. Divergence, insufficiency, excess, accommodative paresis or spasm, meaning you have difficulty going from near to far vision. All of those things might make it difficult for you to see clearly. And all of those things can increase headaches after a brain injury. So that's a number one thing that I refer to a lot because it made such a big difference in my world. And I didn't know I had visual issues until I saw my neurologist and he did some testing on me and it identified it, sent me to the neurooptometrist. We did further testing and it really clarified all of the things that I wasn't able to see, but I wasn't able to realize that I couldn't see. So for those 6 months, we did all of those things I listed on that last screen, except for the speech therapy. That did come a little bit later, but we did all of those things. And finally, my neurologist, who I love and adore, and I realized that I was in the lucky few people that had a neurologist that said, we've tried everything inside the box. I think it's time to look outside the box. What else can we do to help you get better? Because what we're doing is not working. And if you continue to do the same thing over and over and expect different answers, that's the definition of insanity, right? So we didn't want to go insane in this. We'd been doing all the things and I wasn't noticing any difference. So it was time to expand our thinking. So some of the outside the box treatments that I did, we'll go through each of these individually coming up here just to give you a little example and explanation of what each of them are. Red light therapy, transcranial laser therapy kind of goes along with that red light therapy. EWOT is exercise with oxygen therapy. PEMF is pulsed electromagnetic frequency or magnetic field, which we'll talk about, neurofeedback, peripheral nerve stimulation, audiology, and neurological chiropractor. And as I mentioned, we'll talk about each of these coming up. And I'll also add a few things in that I learned about that I didn't experience personally, but I have sent patients to because of all the research that I've done and learned about them. So each one individually here. Photobiomodulation, or PBM, is the fancy term, the medical term for red light therapy. Red light therapy has been around since the 1960s. In the 1970s, they started doing some research with specifically brain, but it wasn't until about 2007 that they really started documenting it, researching it specifically for brain injury, and having some of the articles come out to say that yes, it's beneficial and it's actually treating patients that have brain injury. So red light therapy, oftentimes it's used in the form of a bed. So it looks like a tanning bed, but it doesn't tan you, and it typically doesn't get very warm either. You're laying on this hard plastic, getting red light, which is infrared and near infrared light. And that near infrared light, there are certain frequencies that are good for brain healing that you don't get in every red light center. So whether you get the home treatment machines or you go to a facility and do the red light, you do need to make sure that it's the correct wavelength and correct frequencies. Most of the home machines do not have that. They don't have the settings that go up high enough. There are a few that are a little bit more promising in the form of like a cap or different head type of units that would have the correct frequency. And typically in the research, they've identified between 810 and 850 nanometers of red light. So that's that kind of magic frequency that we need to use. A lot of red light panels don't have that. So again, not all red lights are going to be created equal. Typically, when you see red lights popping up at many of the spas located around your areas, they're going to be a red light panel or a lower frequency, or they can't make any adjustments to the frequencies. Most often, you need to look for something that carries a medical grade red light because they can adjust the frequencies and make sure they actually have a frequency that they can use for brain healing. So that oftentimes it's in that red light bed, as I mentioned. And then we can also do photobiomodulation in the form of a transcranial laser therapy. There are some companies that use like a red light cap or a helmet, and then some that use a wand where they would do a wand, kind of like an ultrasound, like you would see for someone who's pregnant, but we're doing it on the skull for patients to try to improve the blood flow and decrease inflammation in their brain. So in this, it's a 5-10 minute treatment usually. And it, again, decreases the inflammation in your brain, promotes improved blood flow, and it can actually help increase blood vessel formation into the brain. So we can create new blood vessels by doing this. While we do the treatment, sometimes people report that they get decreased headache during the treatment. They have improved cognition or thinking, memory, focus, and it improves the mood. It has been proven beneficial for things like ADHD, for depression, for PTSD. All of those things can be treated via photobiomodulation, also known as red light therapy, if you don't want to try to say this one big, really long word, but very beneficial. It is a little bit easier to find because more places are starting to open up doing this across the nation. And it's a really neat therapy if you're able to find it. The bad part about it is that when we talk about most of these outside the box treatments is that they're going to be out of pocket as well. Sometimes we can get this covered by work comp. There is a place here in the Twin Cities area in the Minnesota that accepts workers' compensation. So we can get patients into that red light therapy if they have work comp. That way they don't have to pay for it out of their own pocket, per se. The next therapy then is exercise with oxygen therapy, or the hyperbaric oxygen therapy is what the HBOT is. And EWOT and HBOT are both beneficial treatments for also improving blood flow to the brain, improving cognition, so that thinking, memory, and reducing headaches. There are different ways that we do them. Exercise with oxygen therapy is typically done on a bike and you're wearing a mask. This little picture here is actually me on the bike when I was using it at the center that I went to. So breathing that 92% oxygen through a mask that's attached to this really big bag over in the corner of the room. And it's recommended to do about 3 to 5 days a week. It's 15 minutes on the bike. Typically, you're trying to go faster or slower while you're on that 15 minutes. Some patients need to do it on a recumbent bike if they have any back issues, can't do the arms on it, but it's a really good option instead of doing 60 to 90 minutes in a hyperbaric chamber. So there are multiple places across the United States opening up again that have both of these types of treatments. And the hyperbaric oxygen, again, has been around for a very long time. Both of these started in the 1960s, increased use and research in the 1970s. But that hyperbaric would be 60 to 90 minutes in a chamber, breathing 100% oxygen, but you're just sitting there. I did try this once just to see what it felt like. And I'm much more of an active type of person. So the EWAT was a better option for me because I liked being able to do that. But some patients can't do the exercise, in which case the hyperbaric might be a better option. Again, most of these are going to be out of pocket treatments. And depending on the facility that you go to, we had a new place open up here in Minnesota that I went and looked at. They do offer packages, so you can get discounts on the treatments. And there are several of these that have been popping up around the United States that I've seen as well. So either one of those would be good options also. And then the PEMF, that pulsed electromagnetic field. It can be done on multiple levels. So sometimes this was just one of the stock images that I found. You can lay on a mat, you can sit in a chair, any one of these options. And basically what's happening on this is you're laying or sitting on this magnet essentially that has a pulsed electromagnetic field on it. EMFs, electromagnetic frequencies, come from everything around us. We're all on our computers right now watching Zoom. Your computer puts out EMFs. Your phone puts out EMFs. Your TV, all of our electronic devices put out EMFs that are a higher frequency that actually drain our body's battery and they decrease our ability to fight off illness. They decrease our immune system. PEMF is the same frequency as the earth. So, as I like to always tell people, think about when we were kids and we were running around outside barefoot. If you were in a neighborhood that you could do that. I grew up out in the country. We walked around barefoot all the time and we never got sick because we were walking around barefoot, getting that earth's energy. And in today's land in 2026, we are all walking around with shoes on our feet. We're in concrete buildings. We're not getting that same earth's frequency. So laying on one of these mats, or whether it be a chair or a bed, you can do this every day, typically 10 to 15 minutes a day, and that will help to decrease the inflammation in your body for multiple reasons. But for the brain, it's also really good for reducing the inflammation and improving the blood flow to the brain again. There are certain frequencies that you can do on the mat that's more specific to the brain than it is to general body formation. But PEMF, again, that's popping up in all sorts of different ways. If you do a search for this online, you can find little devices that you can do at home. These mats, even a basic one that you can get at home, couple $100 maybe. So they're not extremely expensive. It's a much better option for pricing wise compared to the last slides that I've talked about. But there are lot more options popping up for general public. So you don't have to go someplace every day. You could get this at home. Some people will go for a version of this, which is like a grounding mat and grounding mats, grounding sheets. I will say just be cautious with some of those because sometimes the hype is not all the same as what it actually is. Those tend to be things that you can lay on for longer periods of time. And for those, I would say, yes, you do need to pay a little bit more to get a higher quality, to get the better frequencies and wavelengths on that. But that's also a really good option for that. Neurofeedback is a little bit different. In this one, you might actually be able to get a little bit of insurance coverage depending on where you are. So, neurofeedback starts with brain mapping. We do a map of the brain. On this picture, you can actually see me sitting in front of a computer that we did that. You'd wear that little cap like that for like we do for EEGs. If you've heard of EEGs, EEG typically we're looking for seizures. This is not the same kind of EEG. It's an EEG based training, but when we put on these little caps, we're looking at the brain waves, which are the alpha, beta, theta, and delta. And each of those brain waves are active in different areas of the brain. Some areas are higher activity than others for each of these. And what we're doing is mapping out either hyperactivity or hypoactivity in the brain. Try and identify what part of the brain is not working potentially where it's supposed to. And then we can train based on that. So when I did this type of training, I actually went through a couple different rounds of it. Once we mapped out the brain, we identified which areas were not functioning appropriately. And then I was instructed to put a couple of leads on different places on my head, kind of using a little gel transducer to get that information in. And while you're doing the training, you're watching something on the screen and you're listening to it. So you've got these headphones on as well. And while you're watching and listening, it's like a biofeedback mechanism. If anybody's done biofeedback for like muscle aches and pains, you get that direct feedback immediately to the brain. If your brain is not within those waves that's set in the parameters, the screen goes dim, the sound goes dim, so you can't see and you can't hear it. Is it giving that immediate feedback to your brain that something's not right and we need to change and get in the right frequency? And once your brain waves react and they get back in that same frequency, they get that immediate response, that immediate feedback, because the screen comes back on, you can see it, the sound comes back on, and you can hear it. And as long as your brain is doing what it's supposed to do and stays within that frequency, then you can see and you can hear it, and it retrains your brain. This is something we can't physically do ourselves. We can't physically retrain our brains, but it can train itself using this kind of technology. Typically, for a brain injury, we're doing 20 to 40 sessions. Sometimes we do more. And again, it can be done either in office then or at home. Some facilities have the option of sending you home with a home unit, and you have your computer at home. They instruct you where to put the leads on your head. And you do typically weekly follow-ups to see how are we doing? How's the training going? And they can adjust those where you put those locations at any point to make sure that we're training the right part of the brain. This can be used, again, for multiple reasons, not just brain injury. A lot of times, psychology clinics will use this for treating mood. So, mood is also a very common issue after brain injury. So, we can treat the mood, we can treat chronic pain, such as headaches, and see some cognitive improvement as well. The second time I did a round of neurofeedback, I actually had 40% improvement in my brain function. The brain waves were doing what they were supposed to do. And that's when I started being able to read and understand what I was reading again. So, really, really useful tool. Again, sometimes you can get reimbursement from insurance, especially for that mapping part of things, and then potentially for the neurofeedback, depending on where you live. Peripheral nerve stimulation. This one is kind of neat because you don't necessarily have to go somewhere to use this one. But peripheral nerve stimulation is really good for people that have difficulty with their central nervous system. So the nervous system, when we're talking about that, think back to biology class when you learned about the autonomic nervous system. We've got our sympathetic and our parasympathetic functions. Our sympathetic, that's our fight, flight, or freeze, as sometimes people call it as well, that fight or flight mode. And then the parasympathetic is our rest and digest. When we get stressed, the sympathetic gets activated and it kind of stays activated a little bit longer than it should in patients that have had a brain injury. Sometimes we also see that parasympathetic not as responding quite as well, but it's not as common as to see the sympathetic nervous system be out of balance. So what these peripheral nerve stimulators do is try to help to calm that system so that we're not constantly in that fight or flight mode. So there's a lot of different devices that we can use. This picture is actually the Apollo device, which I'm going to be trialing soon. So I'm really excited about that one. I've used it a couple of times with my neurological chiropractor to calm down my nervous system at the moment when I had a really bad headache, and it worked amazingly. The Dolphin is also one that I have used, and the Dolphin, it was kind of funny. If you look it up online, the Dolphin NeuroStim, it actually makes this little squealing noise when you get to the right spot for the nerve transduction. So it's really kind of cool. You can get these kind of devices for use at home. With the Dolphin specifically, there are some places across the nation that are using it with like occupational therapists or massage therapy locations to treat concussion. There is a concussion protocol that a provider can use to treat you with this. The main trainer for this is down in Florida, so I know she can kind of go anywhere and train locations. We don't have that location treatment option here in Minnesota, but I was able to get the machine myself and use it out, and it's also really cool. Pulsetto is one that sits around your neck and has a couple little vibrations that sit right where your vagus nerve comes down in your neck. So that one can help to calm. It's really good for calming anxiety and that anxiety portion of the nervous system kind of being overactive. So that one's another option. And Hoolist is another little handheld that there's different versions of it. So Hoolist makes one that you can get over the counter, as they say. You can buy it online and use it again on the vagus nerve. There are some versions of that Hoolist that neurological chiropractors, chiropractic neurologists, whatever you want to call them, can use in practice that have different settings on it and can actually be used in different places other than just the vagus nerve. So sometimes there's a professional version of these machines, and there's an individual version that you can buy online and use at home. And they might have a slightly different purpose for them. But again, the purpose overall is to improve that cognition, improve your metabolism in some cases, and also just reduce that pain that can come with it. Headache being one of the more common ones. So again, very important for those patients that have issues with the autonomic nervous system or that central nervous system. With audiology, this is one that we don't always think of as outside the box treatment per se, but it's difficulty with understanding and not so much just the hearing loss, but understanding what you hear. So tinnitus or ringing in the ears is a common thing that we hear after a brain injury. Auditory processing disorder is also something that's fairly common after a brain injury as well. It can happen with or without, but if you've never had issues like this before, and now you do after your brain injury, then it's probably brain injury related. The auditory processing disorder is not going to be found on that typical audiometric test that an audiologist does. Normally, when they're doing that testing, they're trying to see, do you have hearing loss? Do you need hearing aids or something for that? And this is not a typical hearing loss. It's more of a hidden hearing loss. It affects the frequencies that aren't necessarily there all the time, and it makes it difficult for us to understand and process what you hear. For example, if you are in a public space and multiple conversations are happening at the same time, somebody that has auditory processing disorder may have difficulty understanding all of those conversations. They may hear words incorrectly. So you hear different consonants. It might make a ba sound like a da instead, and you hear different sounds. So you're hearing the wrong word. So you might answer a question incorrectly because you didn't hear it correctly to begin with. When we have difficulties with our hearing, whether it's a hearing loss that can be appreciated on a regular audiogram, or if it's a hidden hearing loss where we do have those kind of mistakes in our hearing, it can also impact our memory because you can't remember what you didn't hear correctly. So sometimes patients will tell me they're having memory issues, and we kind of tease out a little bit, and we find that they're really having some of these sensory issues. They're getting overstimulated by a lot of sounds. They can't understand what they hear. They can't remember what they hear, or they're hearing the wrong things. I have the really joy of being able to send people to a phenomenal audiologist in my area. She's one of only 5 people in the nation that does this FFR testing, which is frequency following response. It's advanced testing for auditory processing disorder. Normal audiology testing, they place sounds in your ears, excuse me, and you have to repeat the sounds. So you have to focus really hard to understand what it is you're hearing. And some patients will do okay on those tests, and they'll test fairly normal or within the normal ranges. But if you have a really good audiologist, they'll be able to tell that you worked really hard to get to that response. And you may be very symptomatic after you're done with the testing because you worked so hard to get to that response. With the FFR testing, you can't fake your way through it. You can't force yourself to do better because there are several leads. There's some EKG leads. There's different nerve testing that's going on. So it's sending the noises and sounds to your ears, but you're not verbally responding. The nerves are telling whether or not they're hearing it correctly. So that's why I'm saying you can't really kind of fool your way through this test. You either do or you don't have it. So even people that score fairly well on the original audiogram might show as having significant auditory processing disorder on this FFR test because it can test the nerve's response. So it's a really cool test on this and much more advanced and inclusive than the regular testing. I was going to look up and see if you guys have one in New Jersey, and I forgot to look that up. So I apologize. I was going to try to have that information for you. What treatment would we do for auditory processing disorder? There are different types of sound therapy that can help to retrain some of those sounds. Some of them can be on apps on your phone. My audiologist here in Minnesota has been testing out that and sending me some of the apps to try out and see how valuable they are. And then some hearing aids can be helpful. It's not the type of hearing aids you would think of that help you necessarily hear the things around you. It doesn't make things louder. I actually have them now myself. What it does is decreases all of some of that extraneous noises around you so you can focus on the conversation. It has allowed me to go to a restaurant with my husband and hear the conversation that my husband and I are having and hear what the wait staff is asking questions for and not to be so overwhelmed by all the sounds around me. My middle child is in theater, and he was in a production last summer where we went two different nights. One night when I didn't have my hearing aids, and the second night with. And the first night, I couldn't understand everything that was being said on stage. I couldn't laugh at the jokes because I didn't catch them. And that second time around, my belly was sore from laughing so much because I caught every single joke. It was the coolest experience. And I told my audiologist I didn't want to like them because I didn't want another thing to wear on my ears. But I share that story with my patients to help them understand that just how beneficial it can be when we get the treatment that we need. Because when your brain is no longer constantly trying to understand what it's hearing, it decreases the brain fatigue as well. And that's a huge thing after a brain injury. So, very, very cool. Again, typically not necessarily thought of as outside the box, but it's outside the box as far as this comes because auditory processing disorder is something that's often missed. And then the neurological chiropractor. I've kind of mentioned this a couple of times. And what do I mean by that? Depending on where you are in the United States, it might be called a chiropractic neurologist, a functional neurologist, a functional chiropractor. They go by different terminology. Basically, what they are is chiropractors that have specialized training in neurology, oftentimes by the Carrick Institute, which does a lot of functional medicine training. They through their treatments, they stimulate that neuroplasticity, that ability of the brain to regain function and learn new skills. They can do things like vestibular training, again, using different technologies. They can do some vision training. They can do work with that autonomic nervous system that we talked about. They often work alongside other practitioners because there's not necessarily going to be the end all catch all of everything, but they can really work on that functional side of things. When when you work with a neurological chiropractor, it's not like going to your typical chiropractor. It's not a you go, you get an adjustment, you leave type of thing. You go, you spend a good hour or more with this chiropractor, learning different techniques, doing exercises, doing some of these trainings while you're there with them. They might involve use of a laser therapy or the wearable technologies, the nervous system technologies we talked about already, utilizing some of those while you're in your appointment and potentially sending you home with some of that equipment so that you can use that when you're not there. And then they just might give you some exercises that sound a little goofy. Like for the autonomic nervous system, doing cold water face plunges is the mammalian dive reflex. And when you are plunging your face into a bucket or a bowl of really cold water, you're resetting that autonomic nervous system so that you don't always have that fight or flight mode in overdrive. So, doing all of these things, sometimes they sound a little goofy. As I like to say, they sound a little woo woo, but they really work. And that was the number one thing that when we added that toward the end of my, I can't say end of my recovery, but the end of recovery that got me back to work, this was the tool that got me there. Finally, kind of bringing together all of the other things that I had done. So I had done all of the other things leading up to this one, and this is the one that got me back to work. Trauma therapy is also very important. Again, we don't usually think of mental health as outside the box treatment, but there's a lot of stigma that still is around mental health. And trauma therapy specifically, when we talk about ways that people get injuries, there's often a trauma involved, whether it be from a physical assault, a car accident, some other type of work accident, a fall, anything like that. There can be trauma involved. And if somebody has trauma from a previous injury event, life event that happened, and now they have a brain injury, that can cause problems with their recovery as well. So when we look at trauma therapy, this is doing things like EMDR, ART, or brain spotting. EMDR stands for eye movement desensitization and reprocessing. You're reprocessing the traumatic event so that it no longer is traumatic. It's just an event. EMDR, ART, brain spotting, all of these three things takes that memory and turns it into just a memory. You're no longer triggered by them quite as much, or those triggers don't send you into a spiral. They don't bring up that nervous system and activate the fight or flight system. It's a memory, and it's not as traumatizing as it previously was. ART stands for Accelerated Resolution Therapy. I like to say that it's like EMDR on steroids because it works a little bit faster. So, EMDR typically takes about 2 to 3 months to treat an acute event. So, if somebody had a car accident, they had an assault, 2 to 3 months of treatment with EMDR, typically on a weekly basis, and you have shifted that traumatic event to now a memory that no longer triggers you on a regular basis. ART can be done in 1 to 5 sessions. Those sessions take about 2 hours long. So you're looking at significantly reducing that length of time that it takes to reprocess the memory. And brain spotting uses that same kind of technology and typically works in about 1 to 3 sessions for an acute traumatic event. That does not mean it's one per event. And some people have had multiple traumatic events over their lifetime. You might need more treatment than this because of that complex PTSD part of things. But these treatments are all focused specifically at the injury. So when I have patients come into my office and they're on workers' compensation, for example, and they were assaulted at work, I do refer them to mental health for this specific type of therapy to help treat that PTSD, that post-traumatic stress disorder response. When somebody has PTSD, whether it's from the event or from a previous event, and you have TBI together, I heard a really good analogy of this lately in a country song. They use the connection of fire and gasoline. And that's basically what PTSD and TBI are together. When you have PTSD, whether it's from the event or from a previous event, and you have a brain injury, it will take longer to recover from that brain injury, and might make those brain injury symptoms worse. On the flip side, if you have a brain injury and you have a history of PTSD, what you thought you maybe have worked on in therapy already might just rear its ugly little head again after your brain injury. And now you have triggers again from the PTSD that makes it take longer to recover from the brain injury. So, not a good combination to have together. The good thing is that there are therapies, there are treatments to deal with it. So, I always recommend to my patients you need to address the PTSD and the TBI at the same time. I had PTSD from my car accident that caused my brain injury. And 8 months after my injury, I finally started EMDR because that was the first one I learned about. I learned about the others afterwards, but I did the EMDR. In 3 months of treatment, I no longer had panic attacks while I was driving down the road. I could drive through the intersection where I had the car accident, and I no longer was in tears. It was extremely life-changing for that perspective. So I did not have those panic attacks anymore, but it also allowed me to heal. I noticed after that point, I actually started seeing improvement in PT, OT, and in speech because I could. I no longer had this barrier from that PTSD in front of me. So, very, very necessary to do both of those things at the same time. Now, the next several slides are things that I didn't personally do, but I have learned about them and I've had conversations with people since then, and I've had patients that have used it. So, acupuncture and acupressure. The purpose of this is to reduce inflammation, again, promote neuroplasticity, that ability for the brain to create new connections. There's not a set number of treatments that's really available in the research about acupuncture. It's really individual based. So it depends on what other cofactors you have going on in your medical history, in your life. You might need more frequent treatments when you first start acupuncture and then can taper off. It's very individual. So each individual person would have their own treatment plan for this. Again, sometimes you can get it covered by your insurance. So this is one that you could potentially get treatment for. I do remember a time many years ago when acupuncture was not covered by insurance. So that leads me to think that all of the things that I've talked about so far that are not will eventually be covered by insurance as well. That is my goal for those and my hope for those. But acupuncture is one that you potentially could get covered by insurance and get some treatment that way. And there are some acupuncturists around the nation that specify that they are there to treat TBI because they're a little bit more focused in that area. So also a good thing to look for. TMS has been one that's been really emerging as a new technology as well. And TMS it stands for transcranial magnetic stimulation. It started based on the old therapy with the electric shock therapy. We're no longer shocking people. It uses the same kind of EEG-based technology that the neurofeedback used. So initially you start again with the brain map, like we did with the neurofeedback. And then the treatment is a 6-week treatment, 20 to 30 minutes a day, 5 days a week. Uh, with TMS, they've changed over the years. So TMS was the first version of it, and they came to RTMS, which is repetitive transcranial magnetic stimulation, because then they found that treating one time did not do it. You had to repeat it over and over, build a habit for the brain to retrain itself. And then there have been several companies that have taken it a step further and did personalized repetitive TMS, and that's what the PRTMS is. So there are several companies that do this across the nation again. And from this treatment, there are FDA approved indications that insurance will cover. Depression, OCD, and migraine are 3 of those FDA approved indications currently. And you'll be hard pressed to find a concussion patient that doesn't have at least one of those. So yes, we can treat concussion because we can get it covered by those FDA indications, but it is also used for PTSD, ADHD, autism, and TBI. There are a couple companies that are working right now and trying to get that FDA approval for TBI. So you don't have to have one of those other diagnoses listed in order to get it covered. And they are also doing some research to see, can it be done in less than 6 weeks? Is that a possibility? A couple of the companies that came up with this PRTMS worked very closely with the Department of Defense. So VAs across the nation can get this covered really well through their VA coverage. If you are outside the VA, sometimes it will be a cash-based treatment at this point still. But some of them, again, will be covered by insurance depending on where you are and what kind of insurance coverage you have. This treatment is a really cool technology to just see right off the bat those changes in the brain waves. Whereas the neurofeedback took a little bit of time and kind of that training might be a little bit different, and you're not doing it necessarily every day unless you have the machine at home with you. This is just a different way to get that same kind of outcome. So, lots of things that I've talked about today, lots of different treatments. Again, many of them not covered by insurance. Some of them are. Some of them you might find in your location, some of them you might not, but lots of different treatments. And we'll open it up to questions now.
Thank you so much, Mandy, for that really informative presentation. So yes, we have time for some questions. Kathleen, I see you have your hand raised, and I see you just unmuted yourself. You want to ask your question to Mandy?
Sure. Hi, thank you very much. I am 3.5 years out, also a car accident, but a lot of physical injuries, brain bleeds, broke my neck, unfortunately, multiple surgeries, lots happened. I have a couple questions. Is it too late to try some of these, like the EWOT? I know hyperbaric chamber, you got to be a person who can handle that pressure stuff. So some of these treatments, can you do them this long out? And do you think there's still benefit?
Long and short answer, yes. So we used to say that whatever you got back in 6 to 12 months, that was it, and that there wasn't really much to do beyond that. And that's not true. So I'll be the first one to say that is absolutely not true. Many of my patients that come see me are actually months to years out from their brain injuries. And the thing I always like to say is that the joy of that neuroplasticity, that ability of the brain to make new connections, means that our brain is never stagnant. There's always room for improvement. So being several years out, yes, you absolutely can start something that you've not tried before, and you might see benefits from it. So being almost 3 years out now, I have continued to see improvement as I've added new things. Most of my improvement actually didn't come till close to that 2 year mark. So I was well beyond that time frame that people normally
Okay.
say is the end of cutoff. So yes, long and short on that one. Yes, you can.
All right. My last question is regarding the neurofeedback for to manage chronic pain. So I, due to some of the injury, I have chronic nerve pain. And I've also had shingles in the past. So if anybody knows what pain is like, it's pretty rough. And I tried to be this strong person and couldn't do it. So I'm on meds and it's fabulous. But the side effects of the meds aren't fabulous.
Yeah.
How would you go about something like that with this neurofeedback and with somebody who's on medications?
Yeah, so there is a specific organization called Brain Core, Brain CORE, that they have multiple locations and providers around the nation. That's the one that I've had the most experience with. Their images are really, really the most thorough that I've seen. There are other companies that do the EEG and the neurofeedback. That one is probably the most colorful and the most thorough that I've seen. Doesn't mean others aren't as good, but there are locations all over. I would start by getting a brain mapping done. With the brain map, that's where they can really identify, are there areas of the brain that potentially could be benefited from it? If they can't really find a specific pattern or anything that looks like something that they could treat, they'll tell you, and they'll tell you whether or not you might be a good candidate to actually do the neurofeedback training. But the starting would be getting that brain
Brain
mapping.
mapping. All right, cool. Thank you very much.
Yeah, you're very
Thank
welcome.
you. This was great.
Okay.
Meredith had a couple of questions. Meredith, are you able to unmute and
Yep.
ask
Yep.
your questions? Sure, go ahead.
Hi everyone. Thank you. I love your presentation. I just have a couple questions. Is red light treatment, is it like, I'm just trying to think how it works. Like, is it like a TENS machine or is it like eye movement therapy?
So neither of that on that one.
Okay.
So yeah,
Those were my guesses.
Yep. So the red light therapy, as I was kind of mentioning, most of it is done via like a bed. So you lay in what's something that looks like a tanning bed, and the red light comes on at you. Ideally, you go in your birthday suit, but if people don't feel comfortable going completely birthday suit, and that respect, you can go in undergarments as well. Just trying to expose as much of your skin as possible. It's kind of like when we go out and try to get vitamin D from the sun. You want as much skin exposed as possible, but the different frequencies might be more specific to the brain, and that's the part that you want to look at. So it's the infrared and near infrared light that's used. Some of the beds also include a green light feature, and green light is really, really good for chronic pain and for the brain specifically. So you sit in this bed for, depending on the strength of the bed, anywhere from 8 to 15 minutes. And then 3 to 5 times a week, you can do that treatment, depending again on the strength of the bed. Some of the beds are much higher powered, in which case you only want to do it 3 times a week. You don't need to do it more than that. And if you do, you might actually start to feel kind of uncomfortable. So you can do too much of the red light as well, but that's the most benefit is in a red light bed.
And is that photobiomodulation?
Yes, ma'am. Yep.
Okay. And did you say it could create new pathways?
It can. So through all the research they've done, it can create new blood vessels. So you actually get new blood vessel formation into the brain, is
Wow.
one of the treatment ways. Yeah, it's kind of cool. More than
Uh,
kind of, it's very cool.
when I got my brain injury, yeah, they would say, oh, 6 months to 2 years, that's as good as you're going to get. And I was like, but I keep getting better every
Yeah.
year.
Yeah. I
It's,
actually had a gal that I met last year she lived in Pennsylvania. She came to Minnesota to work with one of our neurological chiropractors. She had had double vision for 17 years, and for the first time in 17 years, she saw single vision again. So,
oh my gosh.
yeah, there's no end for cutoff and treatment.
Yeah, I wrote that in the chat too. Like, never. Like, I still go back to speech therapy 30 years later just to like see what they're teaching, if there's anything new I haven't learned yet, or for a refresher.
Yeah,
Um,
things have changed. Absolutely.
things have changed a lot. Like, when I went back to work after my accident, I wasn't allowed to tell any of my clients that I have a brain injury. And because I don't know what the reason was, but I'd gotten fired from a couple jobs because I told them, because I feel like they'll get better rehab if they know that I understand. I've been there, done that. I had to learn how to walk and talk and speak and brush my teeth, and so. But now it's like that's a good thing that you have a traumatic brain injury and you start your own business and working with other survivors. It's just interesting how everything's changed so much.
Yeah, sure is.
My last question. What does ART stand for? Can you say it again? I missed it.
Accelerated resolution therapy.
Oh,
Yep.
all right.
It's not art therapy where you're drawing things.
Right.
Yep. Just like the EMDR, you're using the eye movements for the retraining. It's just a lot faster than EMDR.
Can I say one more thing about functional neurology?
Yeah.
I actually just found out about it like in the last few years. And there's one in San Diego where I live in California. There's a functional chiropractic neurologist. That's his title. And I went to go see him. I couldn't afford to do the treatment, but I went in for a neuropsych assessment. And the ones I've had in the past are miserable. And you sit there in the office with someone across from you, it's paper and pencil, fill in the dot, and it takes like 4 hours, and I'm just exhausted. So that's what I was expecting. And I got there, he had me like walk around and like pick things up and and watch my balance, and I did some eye movement therapy, and that was it. When he sent me home, he sent me home with so much information I haven't learned in 20 years about my brain. And it lasted about 45 minutes, the whole thing. And I learned more than I've learned from any other doctor I've ever been to.
Yeah.
So
They're thinking smart.
I felt good, and I was like energized to get better. And I'm like, yes, I have hope. It's the opposite of a regular neuropsych eval. You feel stupid and like, oh God, I failed, and you're tired. This was total other opposite. So if there's functional neurology around you guys, I recommend it if you can afford it. Thank you.
No, that's okay. We have about 5 minutes left. Just if we're not able to get to all of your questions, you can email them to us, and we will connect you with Mandy for sure to get some of those questions answered. Janice, I see you had your hand up next. If you want to unmute and ask your question to Mandy.
Hi, thank you. That was so informative. I have a son who's 3 years out of a TBI, and we have tried it. Out of the box has been our motto. So we have a hyperbaric chamber, which he loves. We've recently started hydrogen inhalation therapy, and we've seen a big change using that. And we had a consult this morning actually with the Violite company for the helmet, which sounds, from everything I've read, that seems to be the top one for home use. So my question is, I don't know where to go next. Like, you had so many interesting suggestions, but like what you said to somebody a little while ago, do you think the brain mapping would be a good next step?
It might be a good one, yeah, because there's so many different ways that the neurofeedback can be beneficial. So getting that map and seeing what areas might be dysfunctional can be very helpful for figuring out if that neurofeedback would be a good next route.
And just quickly, the trauma therapy, he does not remember his accident. So would that not be helpful?
So the nice thing about the ART and brain spotting options, you don't actually have to remember the details. It's more of what you're feeling. So EMDR, you're doing a lot of talking about it, and you talk through the trauma. The ART and brain spotting goes with what your body is feeling when you get triggered from it. So it's less about actually sharing the memory, and that's actually really possibly a better option for people that have had assaults as well, because then they don't have to relive it when they're going through the treatment. So even if you don't remember, or if you don't want to remember and you don't want to rehash what actually happened, those two are probably better options, because then you can just work through what you're feeling in your body and reframe those feelings.
Thank you.
Yeah, you're welcome.
Anita, I see that you logged back on. Are you able to unmute and ask your question?
Yes, hi. I apologize earlier. I had gotten a phone call while you were in the middle of your presentation, Mandy, and for some reason my phone decides to mess up when I get interrupted by phone calls, and the volume is never good again, and apparently I can't unmute. So sorry about that. I kept trying.
It's okay.
First of all, thank you for being here with us and doing this presentation. It's been really, really informative. My question, I actually have two questions, one for you and one for Kessler, if that's okay. So Mandy, I was wondering, do you know of any facilities, or do you know of anything maybe possibly in the works where people are going to open a facility where maybe all of these out-of-box type of treatments are under one roof? And if not, could we all get together and pool our resources, and I'll go in on it with you, and then could we franchise it across the world?
Yeah, yep. I wish that was the case. There are a couple places across the nation that have multiples of them. So here in Minnesota, we have a place called Hypercharge Wellness, and they have 5 of those different treatments all in the same spot. And that's the one that I've seen that has the most. There is another place down, I want to say in Texas, and I can't remember the other location, that has multiple treatments, but they're very expensive. So if you can find a way to do it less expensive, the better. When I learned their prices, which are like $6,000 a day versus the $100 a day for the treatments here at the place in Minnesota, that made me feel a whole lot better about our prices, even though I thought those were kind of on the steeper end of things. That the problem is that it's going to be more expensive when you find currently the places that have multiple things in place, because they're so unique and individualized that they kind of hold the market, so they get to price it however they want.
Yeah, that makes sense. And then Kessler, my question for the Kessler Institute is, do you offer any type of these out of the box type of treatments? I mean, I've only been up to Kessler, the one in West Orange, or one of the oranges, to be a participant in a study. So I haven't actually gone there for treatment myself.
Right. So we do have some research studies which are, testing some of these, for example, like exercise and memory protocols with brain injury. So we do have some studies that we are currently working on. So you can find a list of all of our studies on our website, and we could certainly send you a link so you can see some of the work that we're currently doing as well. So, we're at the top of the hour, and we really appreciate, Mandy, your insightful presentation today. And we're grateful for each of you for joining us today. So following the presentation, you're going to have an opportunity to complete a survey about today's event. And if you're unable to participate in the survey at this time, we're going to follow up with an email for your convenience. And for those of you who are asking, Mandy's presentation is going to be placed on our YouTube channel, so you can get some of the names of these treatments and some of the things from her slides that she had presented. And then, so for those of you that are interested in learning more about upcoming events or participating in our ongoing research, much of which can be done remotely, please visit the Kessler Foundation website for additional information. Thank you all again for joining us. And Mandy, thank you again for your wonderful presentation. And we hope that you all have a wonderful day.
Thank you.
Are you ready to be part of something bigger? Join a research study today and help transform lives. Go to kesslerfoundation.org/join.